Understand your health. When was the last time you talked to your doctor about inherited traits that make you more vulnerable to certain illnesses? We invite you to join the Genius community by signing up at buyusforall.com. As a Genius member, you will receive a personalized health risk assessment that helps start the conversation with your doctor. All right, so thank you all for joining us. We're here and live for our Founders Live on glaucoma. My name is Madia Logan, and I am the Chief Member Officer for IndyGeneUS Health. Welcome to you all. Thank you all for joining us. Just want to let you all know at the front end, if you have any questions, you can put them in. If you have comments you want to share, we want this to be interactive. There might be some questions we may not be able to answer today, but we're happy to field your questions and then perhaps answer some this week and answer some next week. So thank you all for joining us today. I'm joined by Michael Akinyele, who's our president and founder, and also Dr. Bradford Wilson, who is our Chief Scientific Officer. So thank you, fellas, for joining me. Welcome. And Michael, I'll pass the ball to you for some updates from the company.
Sure thing. And just a quick funny comment. So last week you had the connection issues. I think this week there's like an echo. So I'm not sure what that's about.
It's always something. I'll just mute everybody except for the speaker.
All right, sounds good. So thanks again for the intro, Madia. Michael Akinyele here. Happy to share just a couple of quick updates. So we are getting ready for Black History Month with a couple of upgrades to our software. So the Genius app will be coming out with a couple more features that we're excited to share with you all in the month of February during Black History Month. So if you haven't already, please go to webapp.buyusforall.com to check out the current version so that you'll be first in line for when the upgrades come out next month. Other than that, we're just busy signing strategic partnerships, engaging potential customers, onboarding new members, and really, when we ultimately think about it, in addition to our partnership, it's really about bringing on board a couple of key advisors. And so we have our Impact Advisory Board with a couple of additional members that just signed that we're eager to announce over the next week or two. But separate from that, we also announced earlier today that Dr. Gordon Taylor, also another Howard alum, has come on board to be a clinical advisor as we start building out our network of culturally competent clinical advisors because we understand the impact of relatability when it comes to delivering healthcare and closing healthcare gaps and addressing healthcare disparities. And so while Dr. Gordon Taylor is not able to be with us this evening, we do have a video of him kind of introducing himself. And so, Madia, if you don't mind kind of running through that. Thanks.
I'm Dr. Gordon Taylor. Thank you for having me. It's been a pleasure. I'll be happy to join the IndyGeneUS team. I'm a board certified emergency medicine physician. I came to Howard University from the African diaspora, from the island of Jamaica in 2001. And I went on the journey to become a physician there, and throughout that journey, I learned many great lessons at Howard University. And I think, there were great leaders and teachers there that inspired me to reach out to our community, and help and be one of the talented 10th, as W.E.B. Du said. So I think that's my responsibility. And, after working 10 years throughout the Northeast in rural emergency departments as well as urban settings, I've seen biases that exist. There are implicit biases within the healthcare staff and within the industry in general. And I'm hoping I can, change that. So my work with Indigenous is to help our community and help them be more aware of some of the health conditions that are really affecting us and killing us, frankly. I went to Kempkin College in Kingston, Jamaica. I left there at 17 and went to Howard University with the dreams of becoming a doctor. I majored in biology and minored in chemistry. It was an adjustment coming from the island of Jamaica, but it was great. I learned a lot, and it was very motivating and inspiring. So I always strive to do well, and I shadowed as a sophomore. I did research and, did everything that I read on the internet that would help you get into med school. So, in doing that, I made some connections and, I inspired to do more than just medicine. So I looked into doing an MBA, and that didn't exist at Howard University at the time. So my senior year, I spoke to the deans of the colleges, and I became the inaugural student of the 5-year MD/MBA program there. So that challenge and that growth that, came from that experience really motivated me. And from Howard Med School, I then went on to train at Brooklyn Hospital Center in emergency medicine, which was great for me. I think the diversity and the volume that you see in New York City is unmatched in the country, really. So I'm very grateful for that experience. After finishing residency, I then came back to the Washington, D.C. area, and I've been working in emergency departments all over. And, based on what I'm seeing, it's motivated me to do more for my community. I often work and I'm the only person that looks like me there. Sometimes across all staff, whether it's janitorial, nursing, or administrative, there's no one that looks like myself. So that is a reason why I think working with startups that are focused on reducing this huge health disparity that exists is important. I wanted to be a doctor at 11, and one of the things that motivated me at the time was my grandfather had Alzheimer's disease. And to me, the surprising thing was that there was no cure for this disease. It was this debilitating condition that made him not remember my name, not remember my entire family's name, or any of the memories that we created in the past, 8 to 10 years that I had known him. And after getting to Howard, Watson and Crick won the Nobel Peace Prize for discovering the DNA helix, and the fascination with genomics and DNA and how we inherit diseases was very intriguing to me. And that led me to IndyGeneUS, because this is a community built for us, and it's gonna help us.
Great. So we're back, and we're going to transition now to talk a little bit more about, or we're going to transition to talk about our main topic of today, and that is glaucoma awareness. Now, I've had the benefit of some previous sessions with Dr. Wilson. So as he was teaching us about glaucoma awareness internally, there was a connection between diabetes and glaucoma that I didn't even know existed. So, Dr. Wilson, we're glad to hear about what's going on with glaucoma awareness, and I will pass the ball you to get us started on the topic.
Sure. But first and foremost, shout out to my former HUCM classmate,
Yes.
Dr. Gordon Taylor, for
Yes.
joining the Indigenous team in an official capacity on the clinical side. He's a very talented emergency medicine physician. One of the many talented doctors that our alma mater produces. Just have to put that out there. So when we're talking about glaucoma, we're actually talking about one of three diseases that are kind of related to diabetes and are often referred to as diabetic eye diseases. And those include glaucoma, of course, cataracts, and the last one is called diabetic retinopathy, meaning it's dealing with the retina of the eye. So when we're talking about glaucoma and we're talking about glaucoma today because January is Glaucoma Awareness Month. Green for glaucoma. Put on a little green shirt today. But Glaucoma Awareness Month, and yes, we're focusing on it because it's associated with diabetes, type 2 diabetes, and that individuals with type 2 diabetes are at 2 times greater risk for developing glaucoma. And what the main issue with glaucoma is related to an increased amount of pressure within the eye that causes downstream effects, particularly where you have impact on the nerve, the optic nerve in the eye, which is, of course, is responsible for your sense of sight, and also the retina and in your eye. And so what happens as a result of having diabetes, individuals with diabetes, there is a system of kind of plumbing. There's a plumbing system within your eye, on the inside of your eye, because there's lots of fluid within your eye that flows and circulates through your eye. And individuals with diabetes, what happens is there are little drainage areas where this fluid drains out of the eye that get clogged. And as a result, the pressure within the eye increases. And then that increased pressure over time puts pressure on the retina, puts pressure on the optic nerve, and it can cause the lens of the eye to get cloudy. And I believe that is probably related to the amount of sugar in the fluid in the eye. So the sugar in your blood causes a lot of issues in the tissues for individuals who have diabetes as well, because there's not supposed to be that amount of sugar in your blood. It's supposed to go into your cells where your cells can burn it for food, right? But because you're having issues with your insulin production, the insulin can't take that sugar out of the blood and into your cells. And as a result, that increased amount of sugar in the blood causes damage to the tissues, most often in your peripheral, in your limbs. So you also have diabetic neuropathy, right, in your extremities. Individuals with diabetes have that also. So I think that the cloudy lens of the eye, and also because you can have retinopathy without high pressure in the eye as well. So I believe that the cloudy lens, and in some cases, the deterioration of the optic nerve or the retinopathy are also caused by this high amount of sugar, probably within the fluids within the eye, causing that damage to those tissues as well. So, and this is referring to the most common kind of glaucoma that we see, which is referred to as open angle glaucoma, meaning that it's referring to some anatomical structures in your eye that are relatively normal, but like I said, these drainage areas of the eye kind of get clogged and cause a problem with the pressure over time. So then that's open angle glaucoma. Then there's what's called closed angle glaucoma. It's another type of glaucoma where, again, the pressure is high, but then you can have glaucoma without high pressure. And again, I think this is more related to the amount of sugar that's in the fluids in the eye as opposed to the pressure itself. So I can make these hypotheses because I've had a little bit of medical education. Like I said, I mentioned I was a classmate of Dr. Taylor's back in the day at Howard University College of Medicine. I didn't complete my medical education, but in terms of my degree, but I did you know,
You did the
sit in
PhD, right?
pathology and virology and a lot of all these other classes, and you know, studied and you know, do retain that knowledge. And I did pass the first step of the board exam. So I did learn some stuff, but I just didn't complete my medical degree there because my calling was elsewhere in genetics.
That's great. That's great. Thank you. I want to ask a question about just, is there prevention? I know that there's a big focus on making sure folks get to the eye doctor. I just had my eyes checked for the year and my prescription actually changed. And so what are the steps you take for, is it about prevention? Is it about early diagnosis? That tends to be the theme for some of the illnesses we talk about. But Dr. Wilson, could you focus on that a little bit or talk a little bit about that?
Sure. One of the great things is that we know that diabetes is reversible, right? There are things that we can do to reverse diabetes. Diabetes isn't permanent, so there are you know, thousands of people who have been diagnosed with diabetes, who are getting off of their medications every day through changes in habits, diet and lifestyle changes. It's possible. We understand that diabetes is also related to, in large part, can be related to insulin resistance. So sometimes you have a problem where you're not making the insulin, but then there's an issue where your body's not responding to the insulin. And either way, it can result in that high blood amount of sugar in your bloodstream, and then it can cause that damage. But diabetes is reversible, right? It is reversible. And so ultimately, what you can do is to address the underlying problem, is address the diabetes, and then you can, you know, the issue is that things go unchecked, and then, you know, they kind of get, get severe. And then sometimes you can't undo the damage that's done,
Right.
particularly in some of these very sensitive tissues of the body, you know, where you can't undo the damage that, you know, some of these conditions cause. And then ultimately, you know, you kind of, you know, it's kind of stuck, not stuck, but it becomes an is what it is situation. And you cannot, you know, you kind of limited in what you can do. But if you, for example, if you know individuals in your family have diabetes, then that might be a trigger for you, a key for you to say, hey, maybe I need to pay more closer attention to what my blood sugar levels are, and maybe see, you know, and, you know, and make sure, and, you know, get your, you know, try to see your clinician and get the blood work done. And so you can get those levels checked, or, you know, even take the initiative to do it at home. There's a lot of at-home testing, you know, kits available, devices available for people to do it at home. Some people just take the initiative to do that as well. Of course, you know, suggest to do it under, you know, the advice of your clinician. But, you know, you can be proactive. You can be proactive and you know, taking preventative steps, and, you know, making it, if you have the ability to get your blood sugar checked, and you can, and if it's not within normal range, then you can start to take the steps that you need to take, and then you can prevent things like the glaucoma, the cataracts, and the diabetic retinopathy.
What are people who don't have access to primary care, or low income, and can't afford a bunch of these things, potentially homeless? Like, what are folks able to do? Are there any resources that are just generally available and potentially accessible? Because I think ultimately with any of these things where it's about early detection, a lot of these folks probably don't get any attention until it's too late. So is there anything out there that people can you know, use or, you know, gather just additional insights other than our app, of course?
Sure.
Just kind of curious what
That
might
was
be
the
out
first
there.
place he was going to mention, Michael.
Sure, sure. Sure, absolutely. There, often there can be, free screening offered by,
Mm.
community organizations, by public health organizations, city, state, federal government organizations that offer free screenings. Then there are also, free clinics potentially available where people can go in and get these types of screenings, and as well as others as well. So, even folks who do not have health insurance, there are ways, to kind of monitor and track these things. And also, I mean, although, when you're, struggling, economically, your food choices, you may have be kind of limited in your food choices. But even like, although it's, even fast food places have some healthier choices, at least nowadays, right?
Not to name
But
names.
understanding that a lot of folks might be eating. I mean, I don't eat it. I try not to eat it a lot, but I eat fast food some kind of every now and then. But,
Me too. Don't feel bad. Don't feel bad about that.
If because of where you are economically and financially, you kind of have to do a dollar menu thing as a regular thing, or this, or whatever the case may be, where your food choices are limited. You can still try to make some choices, that are on the better side by eating more things that are alive. Hopefully, and more plants, fruits, and vegetables and stuff like that can help. Often they call it, they refer to it as a Mediterranean diet, quote unquote. But essentially, all the fruits and vegetables that are in these rainbow colors are there for a reason, right? And the different colors represent different things, nutrients in them that are important for us. So it's important that we get as much color on our plates as possible, essentially, and that's just a general approach, right?
Yeah, I think that's fair, and it's definitely a problem where people are just not aware of what their diet can ultimately do to the conditions of their eye. Um, I think my grandmother had glaucoma, and so she just didn't have access to a lot of things healthcare wise. And ultimately, I think she also developed some cataracts, and so she started losing her vision later in her life. And so for me, it always bothered me around like is there a way to either prevent these things or slow the progression? And is that always linked to diet, or is there a treatment protocol or something that folks could pursue? Not that anyone has the answer. I'm just wondering out loud.
Yeah, for the most part, I mean, what you kind of, it's about being proactive, about making sure that your blood sugar is within what's considered to be the normal ranges, and then what corresponds to that is what's called the hemoglobin A1C. That's another clinical measure of what your blood sugar has been doing over a longer period of time, as opposed to right then and there when the blood sugar is measured at that very moment. The A1C kind of gives you more of a longitudinal view in terms of backwards looking view in terms of how the blood sugar, how your blood sugar has been. So that's the primary thing, is monitoring it. And then, like you said, awareness. Awareness is the biggest things. Like if anyone in your family has had diabetes, then meaning your first degree relatives, meaning a brother, a sister, a parent, or a secondary relative, a cousin, or aunt or uncle, or a grandparent, then you are at increased risk for diabetes. If you've had someone in your family, then you are at increased risk. Oh, one more thing about diet is really important. And one of the things that may surprise or may not surprise people about what's driving things like diabetes in this country is high fructose corn syrup, HFCS. So here's the thing. Carbs you burn carbs for energy, right? Burn carbs for energy, and sugars, starches, and things like bread, rice, all those things are carbs, right? And what we find is that what's in a lot of food nowadays is what's called high fructose corn syrup. And the issue with high fructose corn syrup is the fructose. Now, your body, specifically your red blood cells and your brain cells, they have to burn glucose for energy to live. Your brain cells and your blood cells, they have to burn glucose. But when you ingest a lot of high fructose corn syrup, your body has to first change that fructose into glucose before you can burn it. Right? But the problem is that it's like, but the carbs and the starches are like super fuel, right? But if you're not active in burning that fuel, we're a living machine, and we're a living machine that's programmed to save any energy that we don't burn. So what happens with all that fructose, which also happens to be one metabolic step away from fat, if you're not burning it, it gets converted right over to fat. And you save it for a rainy day. So that's what's happening biologically, but you have this super fuel, this sugar, high fructose corn syrup in all of the food. You pick up most labels on a can is gonna
surprise you. It's not even just like things you'd expect to see it in. I've seen it in HFCS and pretty much everything. We make all this corn, and they're like, what can't we put it in? It seems to be the approach.
Right. Wow. Yeah, that's a whole nother conversation.
Oh yeah, and you're gonna piss off the food industry for sure.
What's interesting to me is the impact you can have on it. What I heard you say very clearly tonight is that diabetes is reversible. And I didn't know that's true for type 1 and type 2, even if you're born with it?
Well, type 1 is different from type 2, and most commonly is type 2 people are dealing with. But type 1 is a different situation where, and that's not a reversible situation. It's a matter of insulin production.
Okay, I understand. Well, thank you so much for that insight. I feel like I learned something every time I talk to you, which is great. Thank you for the thorough description and talking. We didn't get. There's a comment. It might be a question. Oh, okay. We have a question from Lon Ray. We'll take it, even though we have just a couple minutes left. What about African communities? What is IndyGeneUS Health doing to reach people on the African continent that don't have access to health insurance or free medical care?
Happy to touch on that. So we're going through a process now of forming some partnerships, and those partnerships will help us reach the community where we can ultimately help people get onboarded to our Genius app, which is currently available at webapp.buyusforall.com. And as folks get onboarded into the app and join the different communities, complete our surveys so we have a better sense of what their healthcare needs might be, that's when we would then have the opportunity as a business to kind of build the business case to provide some of that free medical care and support for those communities, right? So our entire business model, our vision of providing free healthcare to 1 billion people by 2030 is really built on the premise that we don't want the cost of that care to be a barrier to access. And so it's on us to be innovative in how we think about the business model that's going to allow us to provide that free healthcare. So we're starting today with free health education and a free health risk assessment. And so anyone who comes onto the app is able, from wherever they are in the world, to get a better sense of the risks that they may face, and some information that educates them on that risk, that provides some guidance on diet, provides some guidance on treatment. And part of the upgrades that we're bringing in Black History Month, which I think I want to save till then, will provide a little bit more than just these things. So thanks for the question, Lauren Ray. And ultimately, as everyone has mentioned, we kind of want to build a solution that isn't limited from an access standpoint to how much people can pay. Because ultimately, we recognize that one of the big barriers to healthcare and one of the big drivers of health disparities is poverty. I mean, we just had a conversation now about what it takes to reverse or prevent some of these things, and it's what ultimately gets solved if we can figure out a way to give it to people without making cost a barrier. So. Yeah. I know I ran on long, but this is something we're all passionate about.
We are.
Excited to have it in the hands of people, basically.
Yeah. So this, the app is that step to documenting all of that, which you've inherited and moving forward with a plan with your provider. So I'm really excited about what's coming up. So next week, we're going to hear from our founder and CEO himself. He's going to be on and talking about a condition that affects his daughters called retinitis pigmentosa. So please join us for that. Thank you for joining us today. We'll have a go live summary up on the website and on our LinkedIn pages tomorrow. So thanks for checking us out, and we will see you all again next week. Be well.
Be well.
Thanks, everyone.